Okay, good morning, everyone. I am Jennifer Slattery, Director of Training and Membership for the League of Cities and Towns here in Rhode Island. And today we are excited to have our friends from AARP Rhode Island with us, Catherine Taylor. And I'm going to hand it over to Catherine, who's going to introduce our speaker for today. And I think it's going to be a great workshop, so thanks for attending.
Thank you so much, Jennifer. Good morning, everybody. Thank you for coming today. AARP Rhode Island is once again so pleased to partner with the Rhode Island League of Cities and Towns to share information with all of you about how we can make our communities healthier to live in. AARP Rhode Island is our mission is to empower people to choose how we live as we age. And nothing is more important to that than having control over our health. And I do want to say, too, we have 125,000 members in Rhode Island, and we're pleased to represent them and to serve everybody over the age of 50. We were really pleased to spend most of last year as part of a stakeholder group working with the Rhode Island Department of Health in advising their development of their healthy eating and active living, or HEAL, strategic plan, which my colleague Matt Netta, who's on the call, is going to drop into the chat for all of you. And we participated in the active living portion of the recommendations, and you'll see if you go through it, there's an awful lot there about green and complete streets and the goal of having every municipality in Rhode Island adopt a green and complete streets ordinance at some point. So we wanted to work with the League to share that plan with you and talk to you about everybody's role in achieving the objectives of the plan. And we're so excited to bring with you to you Tina Ansong of Change Lab Solutions. So it's just a leading organization in inspiring this kind of change. And so Tina will walk us through ways that you can really, whatever your role is in your community, kind of bake planning for health and wellness into it. So with that, I'm going to turn it over to Tina. We're going to take, I think, questions at the end. But if you have questions and comments all the way through, Matt and I will monitor the chat and get the questions to Tina at the end. And our colleagues from the Department of Health are on the call as well if you have questions about the plan in the chat too. So with that, it's all yours, Tina. And thank you so much for joining us today.
Great, thank you so much. Just give me a second. Let me share my screen here. Is that okay? Can you guys see that?
Looks great.
Wonderful. Yep. All righty. So, okay. So my name is Tina Ansong. I'm a senior planner with Change Lab Solutions. I've been an urban planner for the last 12 years or so. Most of my experience has been in county and municipal planning. So I'm very familiar with the sort of planning implementation process side of these types of efforts with complete streets. So just as a disclaimer, the information provided in this discussion is for informational purposes only and does not constitute legal advice. Change Lab Solutions does not enter into attorney-client relationships. Change Lab Solutions is a nonpartisan, nonprofit organization that educates and informs the public through objective, nonpartisan analysis, study, and/or research. The primary purpose of this discussion is to address legal and/or policy options to improve public health, and there is no intent to reflect a view on specific legislation. So, as an organization, we work to demystify laws and policies with the objective of achieving health equity. And we do that by connecting across sectors, whether it's planning, transportation, public health, you name it. And we also try to strengthen the leadership skills and capacity of change makers. So AARP, League of Cities, and all of you that are here, we see you guys as change makers, and we just try to share information to sort of increase your capacity to enact those changes to achieve overall population health. So we develop policy and legal tools with an interdisciplinary lens. So we are an interdisciplinary team of planners, policy analysts, and a lot of lawyers. And we do this by elevating practical, evidence-based, and community-centered tools and solutions. So now that you know about me and Change Lab Solutions today, as Catherine mentioned, we're going to talk quite a bit about active transportation and complete streets and their role in achieving health equity, and how important that is for older adults, particularly with aging in place. But to sort of get started, I think it's important to do a little context setting with talking about what are inequities and what are the drivers of inequities. So with that, I'll get started. So what is health equity? Health equity is when no person is disadvantaged in attaining their full health potential because of systemic or structural issues such as social or economic position, education, employment, housing, income, age, or self-determination. And with respect to planning and public health, it is treating people of all races, cultures, and incomes fairly with respect to development, adoption, implementation, and enforcement of policies. So our framing, we use what's called the 5 fundamental drivers of inequity. And there are structural discrimination, which tends to think, if you can think of things like exclusionary zoning policies, there's income inequality and poverty. Wealth often provides access to power and decision-making and decision makers. There are disparities in opportunities. So the opportunity to obtain, for instance, a quality education or even to participate in the democratic process. Like, do you have the option to take off of work, to go vote, etc. There's also a disparity. There's also the disparities in political power. You know, do your elected officials represent you and your interests? And the last one is governance that limits meaningful participation. So is your community engagement process more on the inform end of the spectrum, or as opposed to the collaborate and empower end of the spectrum? And if you have any questions about that, we can ask those later in the chat. So the drivers of inequity, and then now we're going to talk about the types of inequity. So distribution, the first one, there are 3 of them, is distributional inequity. And this occurs when planning policies result in the inequitable distribution of resources, community burdens, or benefits. And this is often the inequity that we can see with our eyes and people try to address, but this inequity is actually the result of the 2 other types. First one being the procedural inequities, which occur when public decision-making processes lack transparency, accessibility, fairness, and inclusion. And the last one is structural inequity, which is when institutions and systems of government lack the processes, practices, policies, and internal capacity to operationalize equity and equitable decision-making. So since we're going to talk about how active transportation affects health, I think it's important to do a little introduction to what we call the social determinants of health. Oh, give me a second. Okay, so what do we mean by the social determinants of health? It is the cultural, social, political, economic, and ecologic and physical settings and circumstances that affect our health. And that is usually by shaping the way we live, work, learn, and play. So here are the social determinants of health. They're education, access and quality, economic stability, social and community context, access to healthcare, and the one that we're going to focus most on today is neighborhood and the built environment. AARP also talks about this sort of social determinants of health in their own framing when they talk about livability and the aspects of the domains of livability, I'm sorry. So with the physical domains of livability, it looks like housing, transportation, and outdoor spaces that accommodate people with different abilities, ages, and income, so that those people from different backgrounds are taken into consideration when planning all these domains of livability. So now that we have a basic understanding of the drivers and types of inequity and the domains of livability and how the physical environments affect our health, let's try and connect some dots here. So the procedural inequities, which affect how or affect who has access to participate in the process, and the structural inequities, which control the laws, policies, design standards, and regulations. So if you think in the transportation context, think what's considered an acceptable level of service, which tends to prioritize how quickly we can move cars along a corridor. That was a metric that was developed by mostly male, middle class, young engineers. So it's not even the movement of people, because transit would be prioritized. Transit moves more people per square foot as opposed to a single automobile. And certainly physical ability and other types of road users weren't centered. So these procedural and structural inequities give rise to many of the distributional inequities. So where are the sidewalks? Are they connected? Are they in good condition? Where do they locate highways? Where do they put street trees? What is the geographic distribution of municipal spending or capital improvement spending? So let's use the suburbs, for example, here. So many people were excluded when the suburbs were being developed, and in many ways that was intentional. So how did all of these communities develop in terms of design? There's a lack of housing choice, both in terms of type and price point. There's a car-dependent design with lack of pedestrian infrastructure and transit service. The land uses are separated, they're widely separated, so you have to drive from one place to another. And then there's a lack of general gathering places, and most recreational facilities are often what you call pay-to-play spaces. Okay, so now we're gonna sort of really dive into the transportation focus side of things. So before we can start talking about complete streets and their benefits, I think it's imperative that we try to understand what are some of the barriers that people experience trying to access active transportation. So the first barrier is a lack of sidewalk connectivity, right? We've all seen the sidewalk that starts and stops abruptly. They're on one side of the street. There is no continuous, safe, and comfortable path connecting people to activities, goods, services, and amenities. The second one is inconvenience. So this example is actually from my hometown here. Give me a second. It's a typical auto-oriented retail corridor. So this example shows the presence of mostly connected sidewalks with crosswalks at intersection, but people rarely use them. And that's because the stores are incredibly far apart, and people would have to navigate across vast parking lots with no clear pedestrian paths. So just having the infrastructure in place does not necessarily mean that it is convenient to use. The third is an uncomfortable bike and pedestrian environment. Another example of the presence of the infrastructure doesn't make the complete street functional to the user. So in this example, the sidewalks are narrow, and there's no buffer between the pedestrian and the cars that, based on the design of the street, looks like the cars are meant to go at rather fast speeds. And the other one is safety. So there's a cyclist using a narrow unmarked shoulder. There's no signal to the drivers to expect to see a cyclist in that location. And there's no designated space for a cyclist. And again, he's in awfully close proximity to very fast moving cars along that corridor. The last one is accessibility. So how often have we seen the scenario where the needs of the sidewalk user is not necessarily seen as a priority, or the user is assumed to be an able-bodied person? So in this picture with the tactile curb cut, it shows that even the technically accessible is inaccessible. Or I can imagine in Rhode Island, sometimes during winter, it may be seen as perfectly acceptable to prioritize the clearing of streets for cars at the expense of sidewalks. So now we're gonna get into the next section, which gets into an introduction to complete streets, as well as their benefits. So what are complete streets? Complete streets are designed and operated to be safe and accessible for pedestrians, transit riders, cyclists, and drivers and users, regardless of age and ability. It's important to emphasize that, as discussed earlier, this is not just reserving space for various users, i.e., is there a sidewalk? Or is there a bike lane or parking? It is also using design to ensure that the connectivity, the convenience, comfort, safety, and accessibility of each type of user is considered. So this may also involve designing for slower speeds. So vehicular speeds, commonly referred to as traffic calming, as many of you may already know. Traffic accidents with vehicles traveling at slower speeds result in fewer severe injuries and death to pedestrians and other users. And what do some of these features of complete streets look like? They're not always physical. There are also some non-physical things that can be done to improve the safety of all road users. So some of the physical features include striping or protected bike lanes, marked crosswalks that emphasize the presence of pedestrians, on-street parking between the protected bike lane and moving traffic. So that creates a safer environment for cyclists. It's also street lighting that improves the visibility of pedestrians and other road users. It can also be a raised crosswalk that has been shown to improve pedestrian safety. Of course, there are tactile strips at crosswalks for the visually impaired, and there are curb cuts for people with mobility devices and countdown crosswalks. Some of those non-physical features include longer crosswalk timing, reduced speed limits, as well as prohibiting right turns on red. So I just wanted to also, as we're talking about the benefits of complete streets, to sort of start off with this example. It's commonly used in the equity space. It's referred to as the curb cut effect. So the curb cut effect is basically, here is a design guideline that was developed with specifically for persons with disabilities, but it's not only used by persons with disabilities, and it benefits other community members. So it's used by parents pushing strollers, delivery people, people riding bikes, skateboarders, people hauling luggage, etc. So a lot of these plans and complete street plans can have wider community benefits that we're not necessarily anticipating. So as we talk about health, walking, there are immense benefits of walking just 30 minutes a day. Walking is a form of exercise that is free. There's often no need to reserve a designated time or space for it. So you don't have to say, this is my designated workout time and I have to go to this place to do this thing. And exercise doesn't need to be strenuous. In fact, it's recommended that older adults over the age of 65 do 30 minutes of moderate exercise a day. And some of those benefits include, strengthening muscles, keeping a healthy weight, lowering risks for a number of health conditions such as heart disease, stroke, colon cancer, and diabetes. It also strengthens bones and prevents osteoporosis and osteoarthritis. It helps reduce blood pressure. It improves balance and coordination and decreases the likelihood of falling. It also reduces anxiety, depression, and a whole host of other physical health benefits. Also, being able to walk without help is one of the strongest indicators of whether someone can live independently. And older adults who exercise regularly are more likely to walk without assistance and do things for themselves around the house. So as I want to reference a study that recently came out last year. And it was a study that looked at neighborhood walkability and how that connects to the overall population health of people living in that neighborhood. And I'll just want to offer the disclaimer that they did use obesity as a metric as opposed to some other like health indicator like diabetes, hypertension, etc. And as attitudes are changing towards obesity stigmatization, I just wanted to put that. I'm going to refer to it as obesity because that's how it's categorized or talked about in the study. But nevertheless, this study showed that people who lived in neighborhoods that are perceived to be walkable, it was found that those people who lived in highly walkable neighborhoods were 1.5 times more likely to engage in adequate levels of physical activity and were 0.76 times less likely to have obesity compared to adults living in low walkability neighborhoods. Now, I know when we're trying to garner support for complete streets, a lot of decision makers like to think of what are the economic benefits or the returns on these types of investments and projects. So we talked previously about the potential health benefits of complete streets. So improved population health is also good economic development, right? A healthy workforce or healthy workers are more productive and take less sick time. And the economic effects of an unhealthy population tend to result in more expensive downstream healthcare spending. So that is sort of like the spending that you spend on hospital or doctor's visits, medication, etc. What was I going to say? It's also a healthier population also is correlated to less medical debt. And so if you have less medical debt, you're more likely to have more disposable income that you can then spend and circulate in your local economy. Also, people often think of older adults as retired, but increasingly they're becoming a more and more important part of the workforce. And many businesses are relying on older adults to fill employment gaps. So ensuring a healthy population of older adults is important for economic development. And it's been shown that older adults living in walkable communities are also more likely to age in place. And aging in place also has economic returns. So the cost of a full-time home care is less than half of the cost of a semi-private room in a nursing home or a private room in an assisted living facility. So those are some of the economic benefits tied to improved health, but there are others. So there's also improved safety, which leads to savings in injury and collision costs. There's also an increase in private investment along most of the corridors that have complete streets improvement. There's also the fact that active transportation is affordable. And there's often a marked increase in economic activity for retail, restaurants, and tourism, increased property values, increased net new businesses, and typically it costs less to build than a typical urban arterial. There are also environmental benefits. The most obvious one being mode shift, which leads to reduced emissions. So that has the impact on better air quality and mitigating the effect of climate change, and also cooler streets as well. So now that we are familiar with complete streets and their benefits, so how do we go about planning and implementing some of these policies? So as an organization that focuses on equity or centers equity in everything that we do, we always try to ensure that the process is equitable. And some of the questions that you should be asking when trying to devise, whether it's an advisory committee or stakeholder groups or etc., are people from historically underrepresented populations represented on the committee. So that is racial ethnic minorities, older adults, non-English speakers, immigrants, etc., low-income persons as well. The other one is, are people with diverse and competing interests represented? Excuse me, give me a second. It's just as important to include people who tend to prioritize driving as it is to include people who prefer cycling or walking. Our Complete Streets projects planned for all neighborhoods, and do Complete Streets projects benefit everyone? So these are some of the questions that we recommend that you ask going into to sort of lay the foundation to ensure an equitable planning process. So as we mentioned earlier in the economic benefits section, there tends to be some increasing property values that accompany a lot of these complete streets improvements, which can tend to, or I can say has the potential to lead to displacement of existing residents. So some of the people that tend to be prone to displacement include persons of color, people 25 and older without a bachelor's degree, renters, low-income people, and households with children in poverty. I didn't mention older adults here, but it's important to recognize that older adults often have many intersecting identities. So you have older adults that are people of color, older adults that are renters, older adults without a college degree, etc. So how can you plan for displacement or try to mitigate the impacts of displacement? And this isn't an exhaustive list, but this is just some of the examples of what can be done on both the business and housing side. Excuse me. So there are small business grants, there's technical assistance, local and targeted hiring, small footprint commercial spaces that tend to be more affordable, and a recognition and a promotion of legacy businesses. And in terms of housing, you can offer some sort of rent assistance, rehab assistance, down payment assistance, rent stabilization, or enacting an eviction prevention plan. So this is now, we're now getting into this section where I think most of the people in the room fall in. So you guys are all what's considered the key players of implementing complete streets, and you all have different roles to play at different stages of the process. So for example, public health, some of the ways they can drive the efforts to implement complete streets include assessing the health implications of the existing physical landscape, as well as existing policies. You can also educate decision makers about the health benefits of complete street design, and conduct health impact assessments. You can also analyze and evaluate hospital injury data from traffic accidents. The next key player is public works. So public works tends to assess and update existing standards such as street design guidelines and capital improvement plans. The public works employees and engineers can conduct bike and walk audits and traffic counts. They can analyze traffic data, bike and ped counts, infrastructure use, traffic speeds, as well as monitor the performance of the implemented project. As far as planning is concerned, it's important to assess existing policies such as comprehensive plans, neighborhood plans, bike and ped plans, zoning codes, etc., to ensure that there is alignment between complete streets goals and those various plans and zoning codes. Planners are also really helpful with leading stakeholder and community engagement efforts to build consensus around new ideas and new plans. And the planners are also responsible for updating those plans and zoning codes. Police and fire, most people don't think, often think of them in the complete street space, but their police are responsible for often conducting the enforcement if there are any new policies, for example, the no turn on red or new speed limits. They're also responsible for collecting and reporting traffic collision data. The fire department has to assess street widths and turn radii and raised intersection heights to ensure that they meet the fire truck fleet standards. And they also ensure that the proposed projects won't negatively impact emergency response, which is an important consideration. So now that we have our sort of internal government players listed, it's also important just to try and garner wider community support to get these policies enacted by, in most cases, a city council. So how do we do that? So one of the most common methods we use is called power mapping. And this was just a mock exercise that I did to try and sort of illustrate or provide a visual aid as to how this may play out for complete streets. It is in no way an indication of how the people on this quadrant actually feel about complete streets or their actual influence on the decision maker. So power mapping is an exercise where you divide a sheet into 4 quadrants. So you have the horizontal axis going from strongly oppose to strongly support, and a vertical axis of most influential on the decision maker and least influential on the decision maker. And depending on both their support and their influence, they'll fall into one of 4 quadrants. So this exercise can help identify who are your allies, and can sometimes be used to identify who has influence on different players as well as the decision makers. And it doesn't mean that for people who oppose complete streets ideas, we should just ignore them completely. It probably just means that we have to start working with those people earlier, try and figure out where the points of consensus are, and figure out how to sort of bring them in the fold. How can we compromise? How can we come to an agreement? Now, the person at the center, the decision maker, it's important to sort of figure out what they're interested in. And with a city council, it often involves reaching out to council members one by one to figure out what each individual city council members' interests are, what their track record on the issue is, what do they stand to win or gain by saying yes, or lose by saying no. The other one is what has prevented them from saying yes so far. And oftentimes, from a strategic standpoint, it can also help to help the decision maker understand your position by not only providing facts, but also by putting the facts into context. Like, what do these projects mean for their constituents and the affected communities? Research is important. Decision makers and city council members often like to refer to research to support their decision, just in case if there's any sort of pushback, they can say the data shows X, Y, and Z. Timing is also important. So when can the decision actually be made? Is the comprehensive plan due for an update? Would this be an opportune time to try and push these efforts forward? Is the capital improvements plan up for review? So those are all some of the considerations that can be taken into context when trying to figure out how to garner community-wide supports for some of these plans. I'm so sorry. And I think that is the end of my presentation there. Yep. And I will stop sharing my screen and I will open it up for questions.
Thanks so much, Tina. That was really great. And I don't see any questions in the chat yet. I really appreciate your discussion about how, how central walking is just to everything, just to our total well-being, and how much would change in society and in the wellness of all people in our economic position if people just were able to walk safely from one place to another as a regular course of their day. Might put gyms out of business. That wouldn't be such a good thing, but yeah, is there any, I'm gonna let's see, change my view here and see if anybody is raising their hand. Any questions, anyone? Randy Palmer from the Department of Health. Hi, Randy.
Hi, Catherine. Great presentation today, and actually no questions, but it kind of got the brain spinning for when we begin to implement the State Physical Activity and Nutrition cooperative agreement that we just received through CDC for the HEAL program. Do we want to think about engaging a coalition again in this work? So we work closely with AARP, we work closely with Grow Smart Rhode Island, and those are probably, like I would say, our usual suspects of our go-to within this space. And I'm wondering if it makes sense to sort of bring everybody together again under one umbrella, because there's more power in us working together within communities than in our own silos. So just something I'm thinking about, and we'll discuss more offline when we get together, once we can begin our grant work.
Yeah, thank you for that note. I would say it's always, the more people you have in your camp to support and message around an issue, the better. I'm thinking of, is it Minneapolis that eliminated single family zoning, where a lot of people thought that would be such a far stretch, there's no way it would happen. And what they did was they started to think about it pretty broadly, like who would support these types of plans. And they were like, well, maybe the employers, the larger employers who need to ensure that their workers have affordable housing will come into the fold. So the Chamber of Commerce was brought into the, you know what I mean? So it's sort of like not necessarily thinking of it narrowly, but more broadly, to try and figure out who else that we're not traditionally thinking of that is so obvious that would benefit and support something like this, that may also have influence on that decision maker at the end of the day.
Absolutely. And that's part of, I think, the power mapping or asset mapping exercise. The other thing that I've been curious about as we reignite this work is how to connect what we call the built environment side of the work to the food and nutrition side of the work. I feel like right now it's like food is in, local food producing and procurement policies, and that whole piece of the work is sort of like in its own lane, and built environment is over here. And I'd like to think about how we can collaborate on both sides as well. I don't know how. If you have any suggestions on that, that would be super helpful.
I would need some time to really think about that, but I'm not sure. I mean, there's a lot of expertise in this room. I'm not sure if there's anybody in the audience that would want to take a shot at chiming in on that as I sort of stew on that.
I think you just need a corner market that has fresh fruits and fresh vegetables that everyone can walk 15 minutes to and walk home 15 minutes, and then you've solved all the problems.
Sure.
Yeah,
I mean, I feel like we're seeing it a little bit here on Aquidneck Island with the partnership between Bike Newport and Aquidneck Community Table with regards to some of the biking educational work that happens through Bike Newport, and on that same plot of land, which was a formerly unused plot of land in the north end of Newport, which was sitting vacant, that they converted into the Big Blue Bike Barn. And on that space now is a community garden. So I think that's a good example of a partnership between the food side and the built environment side. I'd like to see more of that as well.
yeah, and as I was, Catherine sort of jogged my memory a little bit. I know in planning now, there's sort of this idea of the 15-minute city, right? So everything that you would probably need to access and do for recreation, live, work, play, etc., which would be within a 15-minute walk. So that includes having access to fresh, healthy food, and ensure that we're not necessarily so focused on separating the housing from the commercial, from, you know what I mean? So yeah, it's all interconnected.
Thank you.
Any more questions? Jennifer, is there anything you want to add to wrap up?
Yeah, I would just say, excuse me, first of all, thank you for a great presentation, Tina and Catherine and team. It's great to be thinking about these ways to be consciously healthy and what we can do to make our built environment provide that for us. So if there's anything we can do on our end from the league's convening power, I'm happy to help. And if anyone does have other questions, we did record the session, so I will be posting it to our YouTube channel, and we can share it out with any of your other colleagues. And Tina, if you'd like to actually share the PowerPoint, I'm happy to get that out as well to those who signed up.
Sure, I'd be happy to provide the PowerPoint as well as some additional resources that sort of get into the specifics of, you know, the specific numbers of how much less expensive is complete street implementation as opposed to traditional arterial. So like all those like pamphlets and stuff that sort of get into that level of detail, I'll be happy to provide those additional resources as well.
Perfect. Wonderful. Well, we will be sure to share those out. And yeah, so I look forward to continuing this conversation then.
I do too.
All right.
And thank you again, Jennifer, for being, and for the league for being such a great partner in sharing this information with your members, and to everybody who joined today, and for Tina for a great presentation. So much to think about. And if you want to get in touch with us at AARP, I'm at ctaylor at aarp.org, and Matt Netto is at mnetto@aarp.org. We have the easiest emails in the world. And so on a call out, I see a couple of our colleagues from Bristol. I see Warren and Marianne, who we just celebrated their joining. They're being the fifth community in Rhode Island to join the AARP network of age-friendly states and communities. So I know they'll be taking a good look at walkability in Bristol and other great things that they're doing there. So congratulations, and again, guys.
Great. All right. Well, with that, I will thank everyone again for attending and sign us off for today. And we do these workshop Wednesdays every week, almost every week. So stay tuned on our website for more information coming up. Thanks so much, everyone. Have a great day.
Thank you.